It's Monday, January 4th, and time for your Barbados Today morning news update.
Home Affairs Minister Wilfred Abrams assures the situation at Her Majesty Prisons Dodds is fully under control. He delivered the update as government officials, including Prime Minister Mia Mottley, Health and Wellness Minister Lieutenant Colonel Jeffrey Bostic, addressed the recent spike in COVID-19 cases at a national press conference. So far, 49 staff and 121 inmates at the penal facility, including one female prisoner, have tested positive for the viral illness.
We've had the unenviable position where the top 5 in the prison, the top 5 officers in prison, are not at the site of the prison because they're either in quarantine or isolation. And the operational control of the prison has been passed to Major Cedric Proverbs from the Barbados Defence Force, who has been seconded from the BDF to the prison in the position of Assistant Superintendent of Prisons. So security operations continue at the prisons with a combined effort of prison staff, members of the Defence Force, and members of the Royal Barbados Police Force. And I want to thank the BDF and the police force for stepping up to assist us in managing the staff complement at the prison. I keep getting calls and questions as to if there's unrest at the prison. There is no unrest at the prison. The situation at the prison is under control. There have been no reported incidents at the prison that should cause concern to anyone.
Over the last 2 days, COVID-19 cases have jumped to 606. Chief Medical Officer Dr. Kenneth George gave a detailed update on the numbers.
On the 31st of December 2020, we reported a total of 395 positive cases on our dashboard. For the first and the second, there have been an additional 211 cases, bringing the total effective the 2nd of January 2021 to 606 cases, of which 246 were female, 360 were male, age ranges 1 to 95, and there were over 72,500 tests done by the Best de Santos laboratory. In isolation, there are 243 persons, broken down as follows: 122 as inmates from the prison, 121 from Harrison's Point, 10 in some villas, and another 32 which are currently being clinically assessed by the team. That gives a total of 275. In all, there have been 324 recoveries, and unfortunately, we have had 7 deaths.
Meanwhile, Health and Wellness Minister Lieutenant Colonel Jeffrey Bostic is satisfied that the situation has been stabilized.
We have been able to make significant strides in terms of the contacting of persons who we have been able to link to some of the cases that we've had. We've also been able to do most of the testing for those contacts, with some mopping up work that is still to be done. I'm happy that as a result of that, we are beginning to see some patterns in what we're doing. We are beginning to see some light at the end of the tunnel. We are beginning to see where we have to be more aggressive, and given the figures that we have, and the Chief Medical Officer will go into those details, we believe that there's some hope and that we are wrestling with this in a way that would allow us to be able to deal with it in a couple of weeks.
In other news this Monday, a leading local doctor has suggested that the current 9 p.m. to 5 p.m. curfew may not be enough to tackle the recent spike in COVID-19 cases. Major Dr. Adrian Lord, who has been repeatedly warning Barbadians to protect themselves, is suggesting a 2-week complete shutdown.
Curfew is in place, and I think we should extend it. As a matter of fact, I think we should, today's a public holiday. Well, the public holiday means no work day. We need to shut down for about 2 weeks and get this thing fixed back together. I never said I didn't want the tourists to come in or the flights to come in, but now look what's happened. Maybe we need to look at that seriously, because it's not, they're here and they got to get back out. But, it's causing problems. Whether the new variant is here or not is not important to me. The point is that we, Barbadians, let our guard down. We did not protect ourselves. We don't need the government to do it. We don't need the opposition to do it. We don't need the tourists to do it. If they come to our place, when you roam, you do as the Romans do, and we need to get them to do what they're doing here, what we do here, and set the examples.
First Vice President of the Democratic Labour Party, Ryan Walters, is calling for a stringent testing system to be put in place for health workers who come into direct contact with the elderly. Speaking Sunday night as part of a panel discussion called COVID-19 Time to Reset, Walters told listeners that protecting the most vulnerable from the current outbreak has to be part of government's action plan.
It's one thing to focus on the persons that will be affected by COVID, but rightly, as you said, Irene, how do we protect regular citizens who are at risk? We definitely need to introduce specific testing programs for the staff at the Queen Elizabeth Hospital and the Geriatric Hospital.
And the private ones too.
And anywhere there is healthcare for elderly, we need to have a program where there's got some level of continuous testing or overview, because those are the persons that are in charge of the most vulnerable in our society, right? So that needs to be done with some immediacy. We have to make sure persons that are tracking their blood pressure, their blood sugar, how can we give them the devices at a low cost that they themselves can do some level of monitoring at home? How can we introduce technology as well into the mix, where persons can communicate with the doctors or the physicians and nurses using technology to communicate the readings, to communicate how they're doing and so forth, as opposed to commuting and congregating in the hospital or at polyclinics.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional happenings in Jamaica, face-to-face classes at schools resumed today, and as we hear this report from Television Jamaica, there's mixed reaction to the move.
So far, so good. That's how parents at the Boundbrook Primary School in Portland have described the resumption of face-to-face classes this morning. When our news team visited the school, both parents and students were masked up and sanitized at the school's gate. Temperature checks were being conducted. Parents were not allowed on the school's compound. The children were collected at the gate by teachers and brought to their respective classrooms. The school says this will be repeated when school is dismissed. Parents are comfortable with the measures.
The process seems like a safe one. The social distance is not many. In my child's class is 8 kids going to be in class today, so it seems okay somewhat. So we'll see from here how the process, how it goes. It seems safe so far.
I think it's a good idea. Plenty of persons don't think it's a good idea, but from my point of view, I think it's a good idea.
Why you say it's a good idea?
Because, as I say, no parent is allowed in the school, and so far it is healthy, because, with parents and children, sometimes we're going to be standing beside the students and all of that. I think it's good.
In addition to the mandatory wearing of masks, temperature checks, and sanitization, the Port Antonio High School has implemented an additional measure. Each grade has been assigned a specific day for face-to-face classes. This to prevent crowding in common spaces on the school's compound at any given time.
On the international scene, British Prime Minister Boris Johnson today announced a new coronavirus lockdown that takes effect from midnight. All schools and colleges will close to pupils and switch to remote learning until the middle of February. In a televised address, the Prime Minister urged people to follow the rules immediately amid surging cases triggered by a new strain of the viral illness.
We now have a new variant of the virus, and it's been both frustrating and alarming to see the speed with which the new variant is spreading. Our scientists have confirmed this new variant is between 50 and 70% more transmissible. That means you're much, much more likely to catch the virus and to pass it on. As I speak to you tonight, our hospitals are under more pressure from COVID than at any time since the start of the pandemic. In England alone, the number of COVID patients in hospitals has increased by nearly a third in the last week to almost 27,000. And that number is 40% higher than the first peak in April. On the 29th of December, more than 80,000 people tested positive for COVID across the UK, a new record. The number of deaths is up by 20% over the last week and will sadly rise further. And my thoughts are with all those who've lost loved ones. With most of the country already under extreme measures, it's clear that we need to do more together to bring this new variant under control while our vaccines are rolled out. In England, we must therefore go into a national lockdown which is tough enough to contain this variant. That means the government is once again instructing you to stay at home. You may only leave home for limited reasons permitted in law, such as to shop for essentials, to work if you absolutely cannot work from home, to exercise, to seek medical assistance, such as getting a COVID test, or to escape domestic abuse.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.